President Trump responding to an SOS from governors.
It's never been anything like this. And it's vicious. It is vicious.
Announcing FEMA will be setting up emergency medical centers in the 3 hardest hit states. And as healthcare workers sound the alarm about those life-saving masks, companies like Apple and Tesla racing to help. And local governments trying to crack down on those ignoring stay-at-home measures after these startling images of crowds still gathering across the country.
It's insensitive, it's arrogant, it's self-destructive, it's disrespectful to other people.
Also this morning, the ER doctor on the front lines who made headlines on Facebook with that dramatic plea for action for his fellow Americans, well, he will join us live.
No deal. That massive $1 trillion-plus relief bill stalled amidst a partisan divide in Congress over which individuals and businesses should get aid under what conditions. Will it be enough to address the economic emergency?
Europe on the brink. Cases exploding in Spain, fears it could be the next Italy. Italian hospitals so overwhelmed, doctors warn care for anyone besides COVID-19 patients has all but stopped. Safe at home, as millions of Americans do their part adjusting to quarantine life, finding creative ways to get together while staying apart. From NASCAR stars iRacing to the huge virtual dance party joined by 100,000 people, from John Legend to Janet Jackson, the massive show of stay-at-home solidarity.
And celebrating the life of Kenny Rogers, the heartfelt tributes pouring in for the gambler.
God bless you, Kenny. Fly high, straight to the arms of God.
And the unforgettable memory that only Dolly could share.
Live in Times Square, this is Good Morning America.
We certainly do say good morning, America. Hope you had a wonderful and safe weekend. I don't know about y'all, but I paid a lot of Kenny Rogers this weekend in tribute to him. What a legend.
Big Kenny Rogers fan. And you're a country music DJ.
WFPR 14 Country, hometown country friend, yeah.
Where'd that accent come from? Well, that threw me off right there. Didn't expect that. Yeah, we love Kenny Rogers. You know, but Americans are also settling into a new normal. Major cities virtually shut down. And take a look at the usual hustle and bustle we're used to seeing here in Times Square, which is the center of the city. Well, it was deserted over the weekend, and it's a similar sight across the country on Hollywood Boulevard. That street normally packed with tourists, now empty as well, and you can actually see the stars on the Hollywood Walk of Fame.
America has changed for now. There's no question about that. New York and California, 2 of at least 11 states that have implemented or announced statewide closures of all non-essential businesses. The U.S. now has 33,000 confirmed cases, the 3rd most in the world, ranked behind only China and Italy. The death toll has now topped 400. The Senate failed to move forward that massive coronavirus stimulus bill. Those negotiations continue today. And Kentucky Republican Rand Paul became the first U.S. senator to test positive for coronavirus. 2 other senators who he had contact with are now in self-quarantine. That is starting to raise questions about whether Congress is going to actually be able to do their work.
That's a good question. And healthcare workers on the front lines are sounding the alarm, bracing for the worst of the outbreak. The ER doctor calling for action, whose Facebook post made headlines over the weekend, is standing by live. We're going to talk to him in just a few minutes, but we begin with Tom Yamas, who is here in Times Square, the heart of the state, with the most coronavirus cases in the nation. Good morning, Tom.
Michael, good morning to you. The virus spreading in so many parts of the country as governors who have issued those stay-at-home mandates are finding them harder and harder to enforce. And right here in New York City, the mayor here, Bill de Blasio, declaring New York City the epicenter of the pandemic in the United States.
This morning, America at war with the coronavirus, and President Trump telling the nation, quote, the enemy is attacking.
It's never been anything like this. And it's vicious. It is vicious.
And now, following an SOS from governors that more hospital beds will be needed, the president announcing FEMA will be setting up medical centers in the 3 states with the most coronavirus cases. New York being supplied 1,000 beds, 2,000 in California, and 1,000 in Washington. Additionally, the Navy's hospital ship, the Mercy, expected to arrive in Los Angeles this week to help local hospitals, but will not treat COVID-19 patients. Another hospital ship, the Comfort, dispatched to New York to assist in the efforts in the coming weeks. This as some healthcare workers are still sounding the alarm about their dwindling supplies.
It's a scary time to be a doctor in America, and especially in New York.
Internal memos written by Columbia University's chief surgeon, Dr. Craig Smith, say that his hospitals have seen a 50% increase in coronavirus patients, burning through 40,000 masks every day, adding that officials predict the number of cases might not even peak for another 32 days. And some doctors stunned when the CDC posted on their site healthcare professionals should use a bandana or a scarf along with a face shield as a last resort when face masks are no longer available. But the CDC also noting the effectiveness of doing so is unknown. ER Dr. Joshua Lerner posting on Facebook, comparing the CDC suggestion to, quote, sending a soldier to the front line in a t-shirt and flip-flops. Companies like 3M saying they're ramping up production of those critical N95 respirator masks. Hanes retrofitting their factories to produce cotton masks. And Apple and Tesla donating masks from their factories. This as testing is increasing, but not nearly to the level that's needed. These long lines are proof. In New Jersey, a massive rush to get tested at this drive-through facility started at 4:30 a.m. this weekend, but it closed just 30 minutes after opening. They hit capacity. Medical professionals now advise those only with severe cases get tested, meaning those that are hospitalized, symptomatic healthcare workers, seniors, especially those in long-term care facilities or those with pre-existing conditions. Even Dr. Anthony Fauci, the nation's top infectious disease specialist, saying not every American needs to get tested.
When you go in and get tested, you are consuming personal protective equipment, masks and gowns. Those are high priority for the healthcare workers who are taking care of people who have coronavirus disease.
And across the country, local governments are trying to encourage, even enforce, stay-at-home measures. These images show some are ignoring the warnings. Crowded beaches in California, boat parties in Florida, and this video showing a crowded New York City park. Some governors outraged.
It's insensitive, it's arrogant, it's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop now.
Time to grow up, time to wake up. Time to recognize it's not just about the old folks, it's about your impact on their lives. Don't be selfish.
And overnight, South Carolina mom Courtney Doster speaking to GMA after her 7-month-old son Emmett tested positive for COVID-19.
My mom also tested positive for COVID-19 over a week ago. His first symptoms were a dry cough and a runny nose he had had for well over a week before he even started a fever. His fever started on Monday afternoon and it quickly escalated to over 104. So we just want parents to take this seriously.
Can't imagine what that mother is going through right now with her baby. We also want to mention the vice president says the CDC is expected to announce new guidelines on when people who have been exposed to the virus can return to work. The vice president hinting it would involve wearing a mask to work. But Robin, as we know, there are so many across this country that now have no job to go back to.
That's
Robin?
true, Tom. All right, thank you. Joining us now, the ER doctor who posted that Facebook plea that you just saw, emergency physician with UMass, Dr. Josh Lerner. He's there at his home in Massachusetts. And Dr. Lerner, first and foremost, thank you to you, everybody in the medical field in whatever capacity for what you are doing. Your Facebook post really struck a chord with a lot of people, dwindling supplies. Can you tell us what the situation is now like where you are?
Sure. Thank you for having me. Right now, I think in my ER, we're sort of seeing a little bit of the calm before the storm. Our total volume is down, but we are seeing the acute respiratory cases coming in. In terms of supply, we are doing our best to start to try to ration the N95 mask, which is probably one of the more important pieces of PPE. We still have them, but the supply is definitely getting low. We have been asked to reuse masks if we can, to be sort of aware of not trying to just do a one and done, throw them away once we've used them. So while we still have the N95s, the supply is definitely getting low.
How long before you run out?
That's unclear. I think it really also depends too on sort of the volume that we see in the ER. I think something to keep in mind is that for any one patient, there are multiple healthcare workers who are at the bedside. Each of them need the PPE, N95 masks, gowns, gloves, face shields. And so for any one patient, we could be talking about many supplies being used at any one time at the bedside. And so at this moment, I don't know how many more days of supplies we have, but we are sort of using them as judiciously as possible.
I know you're doing the very best that you can. We heard yesterday from the Surgeon General, who said that he had a message for everybody like yourself on the front line, saying that we hear you. Do you feel heard? And what can politicians, business leaders, everyday citizens do in this fight for you?
First of all, I think we do feel heard. Since that post went out, people have been showing up in our ER, donating whatever they have. People have been making masks. This is a mask that someone made and dropped off at our ER. People are dropping off food, any type of personal protective equipment. Painters, contractors are giving us their supplies. A neighbor of mine dropped off a box of N95 masks this morning, left it on my porch. So we are being heard by the American people. I would ask that the people in government, our leaders, work together instead of continuing to try and quote unquote debate with one another. We should be working together to really mobilize as an entire nation to both produce the PPE that we need, to shuttle resources into research and development of treatments and vaccines. We as an entire nation need to come together to fight this.
Well said, Dr. Lerner. Thank you so much. You have wonderful neighbors, and again, we appreciate the work that you're doing and glad that you're just getting a little bit of rest there at home before you go back to work. Thank you for joining us, Doctor. Be well.
Thank you very much for having me.
You got it. George.
Okay, Rob, we're going to move on now to those political leaders that Dr. Lerner was talking about in the battle over how to deal with the economic emergency caused by COVID-19. The $1 trillion-plus rescue package stalled by disagreements over where the aid will go, what kind of conditions to attach. That sent stock futures falling overnight, with analysts estimating more than 2 million people have already filed for unemployment. Our senior congressional correspondent, Mary Bruce, is tracking all the latest. Good morning, Mary.
Good morning, George. Well, right now, the Hill is at a standoff. The political anxiety over this nearly $2 trillion package means that the markets are now headed for a very tumultuous day. After negotiating late into the night, Democrats and Republicans are still not on the same page. But I'm told they are hopeful they can come to an agreement today. Now, Republicans are accusing Democrats of being irresponsible by delaying, while Democrats say Republicans are putting corporations ahead of Americans. They say that parts of this amount to a slush fund for corporations with little oversight and not enough protections for workers. Now, both sides do agree they have to sort this out quickly because Americans need relief, and so do the markets. George.
Mary Bruce, thanks very much. Michael.
All right, thank you, George. And now to the disaster in Europe and sweeping new measures to contain it. Italy is now the new global epicenter with more than 59,000 cases and more deaths than China. In Spain, more than 29,000 cases as officials there moved to extend a state of emergency for another 15 days. And in Germany, Chancellor Angela Merkel is self-quarantining as a precaution, but there are also signs of hope out of Asia. We're going to have more on that in a moment, but first, Ian Panels in London with the very latest. Good morning to you, Ian.
Yeah, good morning, Michael. That's right. A surge in cases across Europe. In Italy, it's now 2 weeks since it went into almost total lockdown, and yet the number of cases there continues to rise.
This morning, Italy waking to ever tighter restrictions on movement. Now, some factories ordered to shut as the death toll from coronavirus now closes in on 5,500 people and the number of cases near 60,000. One medic in the hard-hit region of Lombardy saying they're not eating or even going to the bathroom during their shift because they need to preserve their protective gear.
I'm not concerned for myself. The only problem is that I'm worried that if I get sick, I cannot help anymore.
And now Spain in crisis, facing the third highest death toll in the world, with nearly 12% of all those infected health workers.
Even though you think that you're immune to it and nothing's going to happen to you, you could have problems because of it, you or someone in your family. So just really take responsibility for it and feel lucky that you can just stay at home, because us professionals are also scared.
And in the UK, where the Prime Minister is threatening stricter measures as cases grow, this warning from a coronavirus patient who hasn't seen her family in days.
Anyone? If anyone is thinking, taking any chances, just take a look at me. I'm in the intensive care unit. I can't breathe without this.
Well, that's pretty harrowing, of course. Some good news out of China. Remember, Wuhan, which was the epicenter of the global pandemic, it went into lockdown 2 months ago. For the last 5 days, it hasn't had a single case. But a warning from Hong Kong and other countries in Asia that started to relax some restrictions. They have seen an uptick in the number of cases. George?
That is a warning. Okay, and thanks very much. Let's bring in our experts, Dr. Jen Ashton, who's from home this morning, also Tom Bossert, former Homeland Security Advisor to President Trump. And Tom, let me begin with you. We just saw that report from Europe, but here in New York now, it makes up roughly 5% of the cases worldwide. And Mayor de Blasio is saying April is going to be worse than March, May could be worse than April. Flesh out those forecasts. How bad could it get here?
Yeah, George, so France, Spain, Great Britain, and the United States are now all on the same epidemic curve, that worrisome spread curve. And pretty soon the United States, because of its size, will become the leader in these case reporting statistics. And that will be a terrifying day. What I'm trying to communicate to people in this country, though, is that while New York is very bad, the rest of the country can't take a deep breath and think they're out of this. So I guess what everybody's asking is for a prediction. I'll give one today, George. I think we've got a 6-week growth curve ahead of us in New York City.
6 weeks.
The next 2 weeks will be the most aggressive, multiples of 10 potentially.
Backing up what Mayor de Blasio said yesterday. And Jen, we saw Governor Cuomo yesterday talking about those pictures. Again, we see people in the parks, in the streets. Give everybody a sense of what's safe, what's not when you go outside during lockdown.
So, George, remember that 6 feet number. That seems to be the number that the CDC and public health officials are recommending as distance. But it's important to remember that we're going to have to substitute interaction with other things like we're seeing Zoom and FaceTime. But that doesn't mean that you can't go outside for a walk or a jog. You just have to try to stay 6 feet away. In terms of the don'ts, listen, in terms of our home environment, if someone is sick, do not sleep in the same bed with that person. That social distancing has to occur at home as well. And it means not having friends over to socialize and really not going to areas that are tightly congregated.
We have got to be careful. Okay, Jen, Tom, thank you very much. We're going to stay on this all morning long. Coming up, we're talking to Saints head coach Sean Payton, the first person in the NFL community known to have coronavirus.
We're also going to celebrate Kenny Rogers, tributes pouring in for the country music icon. But first, let's go upstairs to Rob.
Hey, good morning, Rob. We have storms on both coasts, starting with the southeast. Severe weather rolling across Alabama and Georgia. And in the northeast, snow mixing in with the rain could see 3 to 6 inches across parts of northern New England. That's checking the national weather. It's time now for your Select Cities, brought to you by Subaru.
We got a Subaru to give him some adventure, to reconnect and be together. And once we did that, we realized his greatest adventure is just beginning.
Welcome to the most adventurous Outback ever. The all-new 2020 Subaru Outback. Go where love takes you.
Get 0.9% APR financing on the 2020 Subaru Outback through March 31st.
We'll grab the rain gear out the door today. Look at your 12-hour forecast. We're chilly, we're wet this morning, and we've got rain chances with us all the way through the late afternoon, probably about 5 o'clock, the rain ending. Temperatures later today in the upper 40s, mostly cloudy skies at 7 o'clock. Tomorrow looking beautiful. Sunshine returns, high temperatures around 60. We're tracking more rain Wednesday with highs in the 50s, and then sunshine returns Thursday with highs in the 60s. So we've pretty much got rain every other day this week.
We'll be right back.
Your mission: stand up to moderate to severe rheumatoid arthritis and take it on with Rinvoq. Rinvoq, a once daily pill, can dramatically